The fluorescent lights hummed at 60 Hz, a sound most people stopped noticing after the first week. Rachel Torres never stopped noticing it. She heard everything. The ventilator's mechanical wheeze 3 rooms down. The soft click of the intercom. The way Dr. Hargrove's Italian leather shoe squeaked on the tile when he walked, expensive but poorly balanced. She hung her jacket in locker 247, the metal cold against her palm. 8 months as a temp. 8 months of the graveyard shift. 8 months of refilling supply carts at 2 in the morning, of charting in the corner, of keeping her eyes down when the attending physicians passed. The night charge nurse, Sandra, had already left a note on the board, VIP admission, 0600. Commander James Reeves, SEAL Team 3, catastrophic trauma from training accident. Dr. Hargrove requesting full team. The note was crisp, professional, underlined twice. Rachel's hand froze on the locker door. Commander James Reeves. Her son David's commanding officer. The man who sent her boy into harm's way 3 times. Tikrit. Kandahar. Helmand Province. She'd watched David walk onto transport planes with that name echoing in the background of every phone call home. The commander says we move at 0500. The commander needs volunteers. The commander wouldn't send us anywhere he wouldn't go first. She pressed her forehead against the cool metal for a single breath. In the bottom of her locker sat a pair of combat boots, leather cracked, soles mud-stained from roads that didn't exist anymore on any map. She didn't look at them. She never did, not where anyone could see. The boots stayed there, laces wrapped twice, nestled behind 3 pairs of white sneakers and a thin fleece jacket with the sleeves worn at the cuffs. Pain is information, she'd learned once, in a place where electricity and cold and speed were the only languages. She didn't think about the boots during shift. She thought about vital signs and medication orders and whether the 4 line in Bay 3 needed a dressing change. The locker door closed with a click. Oak Creek Memorial's trauma floor at night was a different place than the day shift saw. The hallway stretched longer. The equipment hummed in a lower register, as if the building itself was resting but not sleeping. Rachel moved through the space the way she moved through most spaces, efficiently, minimally, like someone taking up less air than she actually occupied. The other nurses had stopped trying to include her in break room conversations around month 3. She always polished the vending machine with her sleeve instead. She always found a reason to check the supply cart. She always said, "My apologies, I'll be brief," and left before anyone could form a sentence. The night shift supervisor, Marcus, nodded at her from the medication station. "Quiet one tonight." Good. He had a daughter in the Army Reserve. He didn't push the way some of them did. He let the temp nurse be. Rachel moved to Bay 1 and began checking the crash cart. Her hands knew this work the way a pianist's hands knew a concerto, muscle memory so complete it felt like existing in 2 places at once. She inventoried the defibrillator pads. Counted the 18-gauge needles. Verified the ambu bag valve. Everything in its place. Everything ready. Her fingers brushed the edge of the medication drawer and she felt, not saw, the small tremor that came from somewhere deeper than her wrists. Not fear. Never that. It was something else. Recognition, maybe. The body remembering things the mind worked very hard to forget. Around 0530, the emergency radio crackled twice. An incoming trauma. 34-year-old male, Navy SEAL, motorcycle accident during a night training exercise, loss of consciousness at scene, intubation initiated in the field, massive internal bleeding suspected, CT scan pending, ETA for minutes. The dispatcher's voice was professional, calm, the voice of someone who'd delivered 1,000 bad news bulletins and had learned not to put hope into the delivery. Rachel was already moving. The trauma bay needed positioning. She adjusted the overhead lights, surgical white, no mercy in their illumination, and pulled the main resuscitation cart into place. The crash cart, already checked, gleamed like a tiny chrome angel under the harsh light. She positioned the monitor stand. Arranged the ventilator settings on the respiratory cart. laid out the first 2 sets of trauma shears on the side table, one pair marked with initials from the last critical patient. These shears had held a history. Every tool in this room had. She understood that about hospitals, they were places where objects absorbed suffering and still came back to work the next shift. The ambulance doors burst open at 0547. 2 paramedics moved with the controlled violence of people who'd practiced this transition 1,000 times. They wheeled the stretcher in at a run, and Rachel's entire nervous system went quiet in that way it only did when the work became real. Commander James Reeves lay intubated, his face swollen from blunt force trauma, his chest wrapped in gauze that had already absorbed more blood than most people donated in a lifetime. His right leg was wrapped in a field tourniquet. His left arm was immobile, clavicle likely fractured. The paramedic was shouting vitals, BP 70/40 and dropping, heart rate 140, respiratory support on AC mode, 2 large bore 4s established, 1 liter of normal saline in the line, and Rachel was absorbing every word while her hands were already moving, already preparing the warming blanket, already reaching for the EKG lead pads. Dr. Hargrove entered the trauma bay at the same moment the stretcher locked into position. He was a man constructed of expensive suits and the kind of confidence that only came from a lifetime of being right and never being contradicted. He wore a Rolex that cost more than Rachel's apartment. His salt and pepper hair was perfect despite the early hour. Behind him came 6 other physicians, Dr. Chen from interventional radiology, Dr. Patel from trauma, Dr. Morrison from cardiothoracic, Dr. Burke from ICU, Dr. Santiago from orthopedics, Dr. Williams from neurology, and Dr. Kozlov from anesthesia. 7 doctors. Rachel noted the number the way she noted everything. 7 was a full team. 7 was a vote of confidence, or a vote of panic, depending on how the next minutes moved. Transfer on my count, Hargrove ordered, and the paramedics began the handoff. Rachel positioned herself at the bedside, ready to receive, ready to stabilize, ready to do the work that made the difference between the ones who walked out and the ones who left in pieces. Her hands were steady. Her breathing was even. Everything was data. That was when Hargrove glanced up and saw her. His eyes moved across her face, the trauma nurse in the corner, the temp, the invisible one who took the shifts no one else wanted, and she saw the moment his brain catalogued her and filed her away as background. Not a threat. Not even a consideration. Just a body in scrubs performing basic tasks. She continued arranging the monitor leads. She didn't look at his face again. The trauma unfolded in its own language. The CT scans came back, internal bleeding, ruptured spleen, possible retroperitoneal hemorrhage, spinal fracture at L2, pneumothorax on the right side. The list of injuries was a poem written in damage. Hargrove and his 6 doctors moved around the bed like a choreography they'd rehearsed, each one speaking in the shorthand of their specialties, each one adding information to the growing weight of complexity. Rachel hung units of O-negative. Drew blood for the trauma panel. Checked the central line that had been placed in the field. And then Hargrove turned to her. "Get me the update on his insurance status," he said, not looking at her, not waiting for acknowledgement. His family's waiting in the lobby and they're looking for reassurance. "Tell them Commander Reeves is receiving the full care protocol." Rachel was already moving toward the phone, already planning her conversation, already thinking about how to present the information in a way that would be true without being honest, comforting without being false. That was the work. That was always the work. The small invisible adjustments that made the machine function smoothly for everyone except the people who had to make them. She reached the hallway outside the trauma bay and nearly collided with Dr. Hargrove's wife. She was a small woman with pearls at her throat and a face that had been worked on by someone very good at working on faces. She was holding a coffee from the hospital cafe, the dark roast, expensive, the kind that cost $8 and still didn't taste like the coffee she drank at home, which was probably fine because home was probably very nice and very quiet. "Excuse me," Rachel said, and started to move around her. Mrs. Reeves, Rachel realized a moment too late, was also in the hallway. She was tall, with her son David's jawline, and her hands were shaking. Behind her stood a man in a hospital administrator's suit and a woman in scrubs who was clearly the hospital's public relations contact. "We want to know what's happening," Mrs. Reeves said, and her voice cracked on no. He's going to be okay, right?" Dr. Hargrove said James was getting the best care available. "We drove 6 hours from Camp Lejeune Anne. The commander is receiving full trauma protocol," Rachel said, and her voice came out exactly level, exactly professional, exactly the way a temp nurse was supposed to sound. 7 physicians are consulting. He's stable enough for initial imaging and assessment. The surgical team is being prepared." Mrs. Reeves's eyes searched Rachel's face, and Rachel understood in that moment that this woman was looking for certainty, for someone who would tell her that her son, David's commanding officer, the man who had shaped her son into someone harder and more capable and more broken than she'd ever intended, was going to survive the next 24 hours. Rachel couldn't give her that. No one could. The data didn't support certainty. The data only supported probability, and probability was somewhere between possible and unlikely and nothing in between. "I'll have someone from the surgical team come talk to you," Rachel said. "You should have a doctor explain the injuries directly." She excused herself and walked back toward the medication station, where she would spend the next hour coordinating blood transfusions and pulling up the surgical suite availability and trying very hard not to think about the fact that she knew exactly how many stitches it took to close the kind of internal bleeding that made people leak quietly into their own body cavity. She'd counted them before. Not on a SEAL commander. On people who didn't have 7 doctors and a trauma team and Mrs. Reeves in the waiting room clutching her purse like it was the only solid thing left. The trauma bay hummed with machinery and purpose and the particular energy of people doing the most important work of their professional lives. Rachel Torres hung her hands at her sides and waited for the next instruction. The break room smelled like stale coffee and fluorescent desperation. Rachel sat at the corner table with her hands wrapped around a mug she wasn't drinking from, watching the afternoon light cut through the vertical blinds in pale prison bars. Her scrubs were still damp from a 12-hour shift. The name badge clipped to her pocket read, "R. Torres, temporary staff," in letters small enough to ignore. Dr. Chen entered first, tray in hand, and his eyes landed on her for exactly 1 second before he stood. He didn't sit. He turned and walked out. The scrape of his chair against linoleum sounded like a deliberate statement. Dr. Patel followed 90 seconds later. Then Morrison. Burke. Santiago. Williams. Kozlov. 7 doctors assigned to Commander James Reeves's case, and all 7 of them chose to leave rather than share oxygen with Rachel Torres. The message wasn't subtle. It was a choreography of rejection, each exit a small violence performed without words. Rachel didn't look up. She stared into her coffee like it contained classified intelligence. The room wasn't silent, the refrigerator hummed, the ice maker rattled, a surgeon somewhere down the corridor was laughing, but the absence of her colleagues felt louder than any sound. This was the hospital hierarchy made visible. Dr. Hargrove had drawn the line, and 7 physicians had chosen their careers over basic professional courtesy. The kind of calm that comes from having already survived the worst doesn't flinch at broken coffee room alliances. That evening, around 1900 hours, Rachel reviewed the commander's medication orders on the unit computer terminal. His chart was thick with interventions, 2 units of packed red blood cells, continuous propofol sedation, vasopressor support to maintain blood pressure. The standard trauma protocol. But something was wrong with the medication dosing in the evening order sheet. The attending had prescribed 8 milligrams of morphine for push every 4 hours for pain management. Rachel pulled up the commander's renal panel from the morning labs. Creatinine of 1.8. His kidneys were struggling. His filtration rate was compromised. 8 milligrams every 4 hours would accumulate, the drug would build up in his system faster than his body could clear it, pushing him toward respiratory depression, toward the kind of sedation that didn't wake up. She had held wounded men whose breathing stopped because their bodies couldn't process the medication meant to help them. Pain was information. This medication order was a mistake written in good faith by someone who hadn't checked the labs closely enough. Rachel paged Dr. Hargrove. The callback came 4 minutes later. His voice was smooth, irritated, the voice of a man interrupted during something important. Yes, Nurse Torres. Commander Reeves's renal function is declining, doctor. The morphine dosing 8 milligrams every 4 hours. His creatinine's at 1.8. That's accumulation risk. I'd recommend reducing to 4 milligrams, extending the interval to 6 hours. Silence. The kind of silence that has weight. Are you a physician, Nurse Torres? No, doctor. Then you're not recommending anything. You're taking orders. This dosing is appropriate. If you have concerns, you document them in the chart. You don't call me with diagnosis suggestions. Understood. The line went dead. Rachel documented her observation in the electronic record at 19:23 hours with the clinical precision of someone who'd learned long ago that written evidence matters more than spoken truth. She noted the renal panel values, the creatinine trend, her clinical concern about opioid accumulation. The documentation was careful, specific, unarguable. It was also a signal that she'd questioned authority, and in Dr. Hargrove's hospital, that was a finable offense. She found out at 20:47 hours when she walked past the unit bulletin board and saw her name printed in red marker, large enough for everyone to read. The handwriting was Hargrove's. The message was public. The message was deliberate. 3 nurses stood nearby, pretending not to watch her face, which meant they were absolutely watching her face. Rachel's jaw tightened. That was all. No tremble. No sharp intake of breath. No retreat to a supply closet. She stood in front of the board, reading her own condemnation, and let exactly one tear escape down her cheek. It wasn't a breakdown. It was a physical response to rage held so tightly it needed somewhere to go. She wiped it away with the back of her hand without looking away from Hargrove, who had just rounded the corner from the medication room as if summoned by the act of being written about. Their eyes met. Commander Reeves deserves better than your politics, Rachel said. Her voice had dropped an octave. It was the voice of someone speaking from a place that had nothing left to lose, which meant it was the most dangerous voice in the room. Hargrove smiled. It was the smile of a man who'd won every institutional battle he'd ever fought, who'd built his reputation on managing the hospital's most connected patients, who understood power the way other people understood breathing. And you deserve unemployment, temp, remember your place. He turned away, already calculating his next move, already confident that this temporary problem would resolve itself through proper channels. He didn't understand that he'd just crossed a threshold. He didn't understand that some people's patience isn't weakness, it's ammunition being quietly chambered. Rachel pinned the write-up form, took it down from the board, read it one more time with the clinical detachment of someone reviewing an autopsy report. Hargrove's signature was bold, confident, the signature of a man who'd never had his authority questioned and survived to tell about it. She'd questioned it anyway. The next morning, day 3 of Commander Reeves's admission, the real nightmare began. 0600 hours. The lab results came through at dawn, just as Rachel was reviewing overnight vitals on the 4th floor trauma unit. She stood at the nurse's station with the printout in her hand, subcutaneous emphysema spreading across Commander Reeves's anterior chest wall, air tracking under the skin like a warning system nobody was reading. The small crepitus nodule she'd noticed when bathing him yesterday had doubled. His respiratory rate had climbed from 16 to 24. His oxygen saturation had drifted from 96 to 91, even on the 40% mask they'd placed at midnight. Numbers telling a story. Pain is data. She'd learned that in Tikrit, where vital signs didn't lie and waiting for permission got people killed. She paged Dr. Chen, the on-call resident, at 0612. No answer. She paged again at 0618. Still nothing. At 0625, she walked to the resident lounge and found him asleep in one of the call rooms, his phone on vibrate in the hallway. She knocked. Waited. The door cracked open and Chen's face appeared, confused, still carrying the softness of interrupted sleep. Commander Reeves. His emphysema is spreading. Respiratory status declining. Chen nodded slowly, the information traveling through his exhausted brain like a text message over a bad connection. Probably just post-trauma inflammation. We'll monitor it. It's accelerating. I'll write an order for another chest X-ray. We can do it at rounds. Rounds weren't for 2 hours. Rachel stood there, calculating in the language that no civilian hospital understood. Waiting 2 hours with expanding subcutaneous air was how you ended up with tension pneumothorax. That was how you went from stable to dead in 4 minutes. Dr. Chen, I'm recommending we get that film now. And I'm recommending we have a chest tube kit at bedside. Something flickered across Chen's face. Not concern. Offense. This was the temp nurse. This was the woman who'd questioned a medication order last week. The woman Dr. Hargrove had publicly written up. The woman whose name nobody had bothered to learn in 8 months. Rachel, I appreciate your diligence, but I'm the physician here. We'll follow protocol. He closed the door. She stood in the resident lounge hallway, the lab results still in her hand, and made a decision. Protocol belonged to people who had room to wait. Protocol belonged to peacetime. She walked directly to Dr. Hargrove's office on the 3rd floor, her badge clicking against her sternum with each step, a metronome counting down. Hargrove was reviewing something on his desktop computer when she knocked. He didn't look up. She waited. He turned a page on the file beside his keyboard. At 30 seconds, she knocked again. Come in. She entered. His office was exactly what she'd expected, mahogany desk, leather chair, medical school diploma from Johns Hopkins framed at eye level. A photo of him on a golf course with a man in a senator's suit. The man from the hospital board, probably. 1 phone call away from anywhere in the world. Commander Reeves's emphysema is accelerating. His respiratory status is degrading at a rate that suggests pneumothorax development within the next 2 to 4 hours. I've recommended a stat chest film and bedside chest tube preparation to the on-call resident. He's declined. Hargrove removed his glasses. He had the kind of face that looked distinguished when it was supposed to and cruel when it stopped trying. Right now it was the second kind. Is Dr. Chen aware of your recommendation? Yes. And he elected to proceed with standard protocol? Yes. Then that is what we will do. He returned his attention to the screen. You can go. She didn't move. The silence stretched thin. Hargrove glanced up, irritation flashing across his features like heat lightning. Did I stutter, Ms. Torres? There it was. The moment. The crossroads between the person she'd been pretending to be and the person she actually was. In Tikrit, she'd been taught to read danger the way other people read weather reports. In Tikrit, she'd watched 7 combat medics wait for authorization while a checkpoint bled out, and she'd learned the difference between obedience and cowardice. She was standing in a climate-controlled office in Raleigh, North Carolina, in 2024, asking a man who'd never worn a uniform to trust her judgment. The absurdity was almost beautiful. She met his eyes. Commander Reeves deserves better than your politics. The words landed like a scalpel. Hargrove's jaw tightened. He leaned back in his leather chair, the kind of lean that came from years of people backing down first. You're not qualified to make clinical recommendations. You're a temporary staff member, here at our discretion. If you continue to step outside your scope, I'll have no choice but to discuss your position with HR. Are we clear? Clear. She turned and left. The walk back to the trauma unit took 4 minutes. By the time she arrived at the 4th floor nursing station, Commander Reeves was already crashing. 08 for 7 hours. Morning rounds. The 7 physicians appeared simultaneously, Dr. Chen, Dr. Patel, Dr. Morrison, Dr. Burke, Dr. Santiago, Dr. Williams, and Dr. Kozlov, all moving in that synchronized way that taught hospitals practiced. They stood around the commander's bed like pallbearers at a funeral that hadn't happened yet. Rachel was at the bedside, running point on vitals, watching the monitors with the kind of attention most nurses reserved for their own children. The commander's chest was visibly expanding on the right side. The skin had taken on that waxy, distended appearance that screamed pneumothorax. His oxygen saturation had dropped to 88 despite the face mask. His heart rate was climbing toward 160, his blood pressure falling in inverse proportion, a body in free fall, trying to compensate its way out of catastrophe. Dr. Hargrove arrived last, moving with the authority that came from being the person who decided what happened next. "Status," he said. "Tension pneumothorax," Rachel answered. "Right side, full collapse. He needs a needle decompression now, or a chest tube if there's time. He's going into respiratory compromise." "I see that," Hargrove said, his voice carrying the tone of a man correcting someone who'd stated the obvious. He turned to Chen. "When did this develop?" "We noted the initial emphysema on morning labs. We're planning a stat film." "And the films?" "Still processing." Radiologists backed up. Hargrove nodded slowly, as if Chen had just explained something reasonable. He began reviewing the chart with the deliberate slowness of a man thinking out loud. Dr. Patel suggested waiting for the imaging to confirm. Dr. Morrison agreed, better to have definitive pictures before intervening. Dr. Burke raised concerns about liability if they decompressed and the needle caused iatrogenic injury. Dr. Santiago mentioned that they should really consult with the attending thoracic surgeon before doing anything invasive. Dr. Williams wondered if a needle decompression was even indicated given the clinical uncertainty. Dr. Kozlov said nothing, which was the loudest agreement of all. The commander's oxygen saturation dropped to 84. Then 82. Then 79. The monitor alarm screamed. His wife was standing at the far corner of the room, her hands pressed against her mouth, and when his oxygen saturation hit 75, she began screaming too, not words, just sound, pure animal terror. "Someone do something. Please. Someone do something." The 7 doctors exchanged glances. Hargrove was still holding the chart. Rachel could see the calculation happening behind his eyes, the weight of liability against the weight of action. The hospital's exposure against this man's life. It was a math problem, and Hargrove was very good at arithmetic. Rachel stepped toward the bed. "You are not touching this patient," Hargrove said. It wasn't a warning. It was a statement of fact, delivered with the confidence of someone whose facts had never been challenged successfully. She met his eyes. "He's dying. That's not your determination to make. Step back or I'll have security remove you." The command's oxygen was at 71 now. His lips were starting to cyanose, that particular shade of blue that meant his blood wasn't getting oxygen anymore, that his body was beginning to shut down systems, that in about 3 minutes he was going to arrest and stay arrested. Rachel's hands moved before her mind finished catching up. 22 years of training. 18 months in Tikrit watching blood and mortar and the things that happened when you waited for permission while people died. Muscle memory. Everything else faded. She pushed past Hargrove. His hand came up to grab her arm and she pivoted, not roughly, just firmly, and stepped into the space he'd occupied. The commander's chest was beneath her palms now. Her fingers found the second intercostal space, the midclavicular line, the place where anatomy became urgency. A nurse, Rachel didn't register which one, pressed a 14-gauge angiocath needle into her right hand without being asked. The needle was cold. Stainless steel. The kind of weight that meant business. The commander's oxygen saturation was 68 now. She didn't hesitate. The needle went in at a 90-degree angle, aimed perpendicular to the chest wall, her left hand stabilizing while her right hand applied pressure. The resistance changed. The tissue gave. And then, the hiss. The hiss of air escaping. Pressurized air releasing from the space around his lung, the sound like opening a door that had been sealed. It filled the room. It filled the silence. It sounded like rescue. The monitor alarm cut off. The oxygen saturation started climbing, 72. 78, 84. 88, The commander's chest rose symmetrically for the first time in hours. His color improved from grey-blue to grey. His heart rate began to slow from the panic territory back toward something resembling normal. Rachel withdrew the needle. She applied pressure with a piece of sterile gauze. Her hands moved with the certainty of someone who'd done this under mortar fire, under darkness, under the kind of pressure that killed weaker people. Her hands moved the way they'd moved for 18 years when nobody was watching and people lived or died on the quality of her decision-making. She charted the procedure. The room was completely silent except for the ventilator's rhythmic hiss and the steady beep of the heart monitor finding its way back to stability. The 7 doctors stood frozen. Hargrove's face had gone pale. The commander's wife had stopped screaming. She was pressing her hand over her mouth, tears running down her face, watching this woman in scrubs who appeared to have just saved her husband's life. Rachel didn't look at any of them. She simply moved to the next task, calling radiology to expedite the chest X-ray, to confirm the decompression, to document what had just happened in that room. Her voice was steady. Clinical. The voice of someone reporting facts, not requesting permission. Dr. Hargrove remained motionless at the far side of the bed. Rachel could feel his eyes on her. Could feel the weight of understanding beginning to arrive, slowly, the way understanding moves when it carries something heavy. But that wasn't the worst part for him. The worst part would come later, when the 7 doctors' names appeared in an incident report, when the hospital's legal team began requesting statements, when Dr. Hargrove realized that what had just happened in that room wasn't going to be quietly buried in the chart and forgotten. Rachel finished her charting and turned to walk out of the room. That's when the hospital intercom crackled to life, and a voice began paging an extension that didn't exist on any normal day. The voice was authoritative. Military. The kind of voice that came from people who didn't make requests. Dr. Hargrove to the administrator's office. Immediately. The room held its breath. Commander Reeves's oxygen saturation dropped below 60. The monitors screamed warnings no one was answering. Rachel moved forward toward the bedside, her footsteps soundless on the tile, her hands already steady, the kind of steady that comes from having already survived the worst. Dr. Hargrove stepped into her path. His forearm came up like a gate. "You are not touching this patient." Rachel stopped. Her jaw tightened once. Just once. She met his eyes, pale grey, certain of their own dominion, and something in her expression shifted from deferential to direct. He's dying. It wasn't a question. It wasn't a request. The 7 physicians who'd frozen in protocol debate around the monitor stood paralyzed, waiting for someone to decide, someone to act, someone to break the procedural deadlock that was costing the commander every second. Dr. Chen looked to Morrison. Morrison to Patel. Patel to Burke. Santiago's pen hovered over the chart. Williams stepped backward. Kozlov didn't move at all. 7 trained doctors, and none of them would cross the threshold into the space where action required accountability. Rachel pushed through. Her hands moved on their own, muscle memory from a checkpoint in Tikrit where a young Iraqi interpreter had taken shrapnel and there was no surgeon, no protocol, just a choice between acting and letting someone bleed out. She placed her palms flat on Commander Reeves's chest, felt the absence of breath beneath her fingers, felt the tension building in the thoracic cavity like a pressure cooker with nowhere to release. Her right hand found the anatomical landmarks without thinking, second intercostal space, midclavicular line. The needle was already in her other hand, a 14-gauge angiocath, the kind that lives in every trauma bay because sometimes textbook becomes survival. The needle went in. The hiss of air escaping, sudden, violent, almost a sob of relief, filled the shocked room like a gunshot in reverse. Pressure bleeding away. The monitors shifted almost immediately. Oxygen saturation climbing from 62, 68, 74, 81, 88. The commander's color changed from gray to something approximating human. His chest rose. His heart rate steadied. The ventilator's rhythm became synchronized instead of fighting. Silence. Real silence. Not the absence of sound but the presence of it. The fluorescent lights hummed their electric song, the monitor beeped its steady confirmation, the world returned to normal oxygen pressure and normal physics and normal survival. 10 minutes later, the thoracic surgeon arrived, Dr. Matsuda, 64 years old, 3 decades of chest trauma experience, the kind of surgeon who'd seen every variation of human catastrophe that didn't quite become statistics. He examined the commander without speaking, checked the placement of the needle, reviewed the vital sign trajectory from before the procedure to after. He looked at the 7 frozen doctors. He looked at Hargrove, whose face had gone white, then red, then a color that suggested internal pressure building toward explosion. Dr. Matsuda looked at Rachel with an expression that might have been respect or might have been something deeper, recognition, maybe. The recognition of someone seeing a skill executed so cleanly that the difficulty of it became invisible. Textbook needle decompression, he said quietly. Second intercostal, mid-clavicular. Proper depth. Proper angle. Whoever did this saved his life. Hargrove didn't answer. His phone was already in his hand. He walked into the hallway. Rachel heard his voice, calm and layered with something that sounded like concern but tasted like venom when you knew how to listen. Richard? It's Tom Hargrove. I need the board president. Now. We have a dangerous situation. A staff member with a fabricated resume just performed an unauthorized procedure on a high-profile patient. I have serious concerns about her credentials. Very serious. I'm going to need an investigation. By noon, Oak Creek Memorial's chief of staff arrived with 2 security guards whose uniforms hung on them like they were props in someone else's story. Rachel stood at her locker, empty scrub pants and a single pair of compression socks in a plastic bag. One of the guards, young, uncomfortable, avoiding her eyes, took her badge from around her neck. The plastic felt warm from her skin. It clattered on the tile floor like all ending sound. The hallway smelled like antiseptic and something else, something like the end of certainty. Rachel walked between the 2 uniforms, past Dr. Patel who looked at his shoes, past Dr. Chen who turned away, past the nurse who'd handed her the needle, who was crying silently in the doorway of the staff room. The elevator doors opened with their standard mechanical sigh. Rachel stepped inside. The doors closed. The descent was silent. In the administrative office upstairs, Hargrove briefed the chief of staff and 2 investigators he'd personally contacted from a private security firm he'd hired within minutes of the procedure. I have reason to believe Rachel Torres is an imposter. Her credentials are fabricated. I don't know her real background, but I know someone who performs unauthorized procedures without oversight is a liability this hospital cannot afford. One of the investigators, a woman with a clipboard and the manner of someone accustomed to believing men with authority, made notes. What makes you suspect her credentials? She performed a procedure outside her scope of practice. She had no business touching that patient. That level of confidence, that kind of precision without training, it's suspicious. Run a background check. Check her references. I'm betting you'll find gaps. The gaps he didn't know about were classified. They were redacted. They were buried 8 levels deep in Pentagon archives because Operation Phantom Ledger was the kind of operation that never officially happened. Rachel couldn't defend herself. She couldn't say, 12 years and 4 months of active service. 3 deployments. 2 of them to Tikrit. She couldn't say, my credentials are sealed by the CIA. She couldn't say, I was ordered to erase myself, to become nobody, to never surface as who I actually am, and I took an oath and kept it and kept it and kept it. The documents she'd signed were unambiguous. The CIA liaison who'd met her on a base in Kandahar had made it clear, you're off the books. Your records are going to disappear. Your name, your rank, your service, all of it sealed. You're a ghost now. That's the cost of what you know. That's the cost of what you've done. She drove home at 2 p.m., still in scrubs that smelled like antiseptic and failure, hands that had just saved a man's life now gripping a steering wheel in Raleigh, North Carolina, where no one knew what those hands had done or what they were capable of doing when the world stopped watching. David was at the kitchen table when she walked in. Her son. 24 years old. Home on 2 weeks' leave from his unit, dress uniform still pressed and perfect from the flight home, silver collar devices catching the afternoon light. He'd been sitting with Commander Reeves upstairs, thanking the man for his leadership, not knowing his mother worked 3 floors below, not knowing anything except that something was wrong because his mother never came home at 2 p.m., never appeared in the kitchen with her scrub still damp and her eyes red and her hands shaking the way hands shake when restraint is harder than action. Mom. His voice went small. The way a grown man's voice can go small when he sees his mother cry for the first time in his memory. Why are you home early? Rachel sat down across from him. She tried to speak. Nothing came. The tears fell onto the Formica table, and she couldn't explain, couldn't defend, couldn't say anything because everything she was supposed to be had just become everything she was forbidden to claim. David reached across the table. He took her hand. He didn't ask again. He just sat there, in his dress uniform, holding her hand in the kitchen where she'd taught him to tie his shoes and pack a backpack and make decisions that would change everything. The next voice they heard, that would come later. The next revelation. The next piece of a story that wasn't finished falling apart but was about to be reconstructed in front of witnesses. The Iraqi man came through the emergency entrance at 3:02 p.m., clutching his abdomen, blood soaking through a grey jacket. Gunshot wound. Robbery gone wrong 3 blocks from the hospital. The triage nurse began the intake protocol, name, address, insurance, when the man's eyes lifted and locked on a figure moving past the trauma bay. Rachel. Her face. Her hands. The recognition hit him like a second bullet. He began shouting in Arabic, his voice cracking with something between pain and reverence. The angel of Tikrit, she saved my brother when your soldiers would have left him. The angel. She was there. The waiting room fell silent. Heads turned. Security moved toward the man, unsure if this was a threat, until they saw his eyes weren't angry. They were grateful. Terrified and grateful. Rachel paused mid-stride. She didn't turn. She didn't acknowledge him. But she slowed, and that was enough. 1 measured breath. Then she continued toward the trauma bay, her movements precise as a scalpel cut. 20 minutes later, David Torres stood in the hospital corridor in his navy dress uniform, the dress blues pristine, the gold shoulder boards catching fluorescent light. He'd been visiting Commander Reeves, sitting at the bedside of the man who'd commanded his unit in Kandahar, when the shouting started downstairs. Now he stood in the lobby, watching the scene unfold around the wounded Iraqi refugee, the shouting, the nurses translating fragments of Arabic, the raw emotion of a man whose brother had lived because of one person's hands. David's jaw tightened. He understood now. The puzzle pieces his mother had refused to explain for 8 months. The way she flinched when certain names were mentioned. The way she woke at 2 a.m. sometimes and sat in the dark kitchen. The way she'd taught him that some secrets weren't your burden to carry, they were your burden to keep. He stepped forward into the chaos, into the cameras and the questions already starting to form in the minds of the gathered staff. He wore his dress uniform like armor. His voice cut through the noise, not loud, controlled, the way commanders speak. My mother is Senior Chief Petty Officer Rachel Torres. The room didn't go silent. It went hollow. The kind of silence that happens when air leaves a space. When oxygen vanishes. 7 pairs of eyes, Chen, Patel, Morrison, Burke, Santiago, Williams, Kozlov, went wide. The refugee stopped shouting. A nurse's clipboard clattered against tile. Someone's radio crackled and was immediately turned down. David didn't move. Neither did Rachel, who stood at the entrance to the trauma bay, watching her son with the expression of someone who'd just watched the last thread of her cover burn away. A nurse named Patricia, 30 years at Oak Creek Memorial, competent and careful, one of the 7 who'd walked away from Rachel in the break room, moved toward the locked administration office without being asked. Her hands were already trembling. She retrieved Rachel's personnel file, the one with the red classified stamp that nobody was supposed to know existed, the one with pages redacted so thoroughly they looked like black dominoes arranged in rows. Patricia's voice shook as she read aloud in the hallway. Senior Chief Petty Officer Rachel Torres. Honorable discharge. Service record includes Operation Phantom Ledger. Patricia paused, her eyes widening at the redacted section, dates and details classified. Multiple deployments. Tikrit, Fallujah, Sanjin Valley. Medical specialization, battlefield trauma. Field rank, combat medic, elevated to senior enlisted. Clearance level, she stopped. Her hands dropped. This clearance level doesn't exist anymore. It was burned. The next voice belonged to neither of them. Dr. Hargrove, is he still present? The Admiral's voice arrived before his body did. Vice Admiral James Mercer, 3 stars gleaming on his shoulder boards like navigation lights, walked into Oak Creek Memorial at 4:12 p.m. with 4 officers in tow. Not a question. A command. The hospital lobby became a staging ground. The Admiral's presence changed the air pressure in the room the way a storm front changes a sky. Everything else suddenly seemed smaller, less important, less real. Hargrove was there, had been waiting in his office, had actually thought he could talk his way out of this with hospital politics and medical school friendships. He emerged from the stairwell trying to smile, trying to remember how to be the confident man who dominated this building 6 hours earlier. The smile died on his face when he saw the uniform. 3 stars. Combat Command presence. The kind of bearing that came from having already survived the worst. The Admiral stood in the center of the lobby with the calm of a man accustomed to being the most dangerous person in any room. His uniform was pressed, his ribbons arranged with the precision of someone who'd worn authority longer than most people had worn shoes. Behind him, the press cameras that had been stationed outside for the gunshot wound story had shifted their focus entirely. They were filming this now. All of it. You are Dr. Thomas Hargrove. The Admiral's voice carried the kind of weight that made civilians step back. Hargrove nodded, mouth opening. Admiral, You obstructed a decorated naval special operator in the performance of life-saving medical care. The Admiral's words landed like strikes. You called her credentials fabricated. You ordered her removal from this facility. You initiated an investigation into the woman who saved Commander Reeves's life when your 7 physicians were debating protocol while his oxygen saturation plummeted to 68%. Hargrove tried to speak. The Admiral cut him off with a hand gesture that meant silence. I have spoken with your hospital board president, your chief of staff, and the North Carolina Medical Board. The Admiral paused. His eyes were the color of storm-dark water. You are terminated from Oak Creek Memorial effective immediately. Security will collect your hospital badge and escort you from the premises. The silence that followed was so profound it seemed to have physical weight. Hargrove's face cycled through red to gray to something approaching white. Richard is my friend. We went to medical school together. The board will never. The board president already agreed. A woman stepped forward from the gathered crowd, her face lined with regret and something that looked like relief. Richard Bancroft, board president, the man Hargrove had been playing golf with for 15 years. Tom, I'm sorry. It's done. Hargrove looked at his 7 physicians. Chen. Patel. Morrison. Burke. Santiago. Williams. Kozlov. The ones who'd stood by him in the break room while Rachel sat alone with her coffee. The ones who'd chosen hierarchy over humanity. They all looked away. Not one met his eyes. The absence of their support was more damning than any words. Then Hargrove turned to Rachel. His mouth opened like he was going to explain, defend himself, claim he'd been protecting patient safety. She stood perfectly still in her scrubs, still invisible to most of the room despite the revelation unfolding around her. But when his eyes met hers, something shifted. Rachel took one measured breath. She wiped her eyes once with the back of her hand. She said nothing. The silence that followed was devastating. It was the sound of a man realizing that his position, his credentials, his reputation, all of it had rested on being able to dismiss someone he'd never truly seen. And he'd gotten it wrong. Catastrophically wrong. Security escorted Hargrove toward the exit, the same doors that had escorted Rachel out 6 hours earlier. His white coat was wrinkled, stained with what looked like the dregs of cold coffee. His hospital badge was confiscated at the security desk. His locker was emptied while he stood there, his personal items, a coffee mug with his name, family photos, medical journals, placed in a cardboard box that one of the officers carried to his car. The cameras captured all of it. The walk of a man who'd been the king of his domain until the moment he wasn't. Then came the Admiral's actual announcement. The medals. The decorations. 2 bronze stars read aloud in sequence, each one its own sentence, each one met with visible reactions from the gathered staff. A Purple Heart came next. Then the last one. The Navy Cross. The words Valor in Tikrit hung in the air like the name of a place where time had been rewritten. Senior Chief Torres held a bleeding checkpoint for 9 hours alone, the Admiral said. While her unit was extracted. While insurgent fire rained on her position. While she performed battlefield medicine on soldiers from 3 nations under mortar fire. He paused. Her brother, the one she was covering, was extracted with critical abdominal trauma. She stayed. She held the line. She made sure they made it. The Irish refugee who'd been shouting in Arabic began crying quietly, understanding now that his brother had been that soldier. That his brother had lived because of the woman in scrubs who'd just saved his life a second time, 6 years later, in a hospital lobby in Raleigh, North Carolina. An FBI agent stepped forward, flanked by 2 colleagues. The same agent who'd sealed her records, who'd told her to disappear, who'd explained that Operation Phantom Ledger was too classified to ever resurface. Now he was explaining the opposite. Operation Phantom Ledger was declassified this morning, the agent said to the assembled crowd and the cameras. Senior Chief Torres was ordered into hiding to protect intelligence assets and operational security. She was forbidden from surfacing under her military identity. The classified protocols that prevented her from defending her credentials today have been lifted. She is cleared. She was always cleared. The erasure was official. The protection was legal. The woman you forced out of this hospital 6 hours ago was operating under direct CIA orders. She has never been and will never be fraudulent. Rachel didn't move. She didn't nod or acknowledge the vindication. She just stood there while her entire identity was reconstructed in public, while the 7 doctors who'd abandoned her realized what they'd chosen to believe, while Dr. Hargrove's world contracted to the size of a cardboard box being carried by security. 6 months later, a different kind of scene played out in the same hospital lobby. Rachel Torres walked in wearing her Navy uniform, the dress blues pristine, the decorations arranged in descending order of prestige across her left chest. The hospital had organized a formal ceremony, a small one, just staff and family, nothing too public because Rachel had requested privacy, but word had spread. Half the facility found reasons to be in the lobby at 10 a.m. on that Thursday. Commander Reeves was there, standing with a cane, his recovery incomplete but his vitality unmistakable. He'd walked into the building using his own power, his lungs clearing with each day, his wound healing in the way that only happens when someone refuses to let you die. He held a small wooden plaque. On it, a pair of worn combat boots. The boots he'd been wearing during the accident. The boots that had been cleaned and preserved and mounted with a single engraved line, for the angel who never stopped fighting. Rachel accepted the boots without ceremony. She held them the way a soldier holds sacred things. Later, she placed them in her locker, next to her own worn pair, the boots from Tikrit, the boots from Fallujah, the boots from every place she'd been asked to save people in the dark. David, promoted now, his own chest beginning to accumulate its own decorations, mentioned something to his mother that evening. "I saw something interesting this morning," he said. Before the ceremony. Rachel looked at him, waiting. Dr. Hargrove's teaching CPR at Raleigh Community College. $16 an hour. His medical license got restricted. No hospital will touch him. His credentials are intact, but nobody wants to hire someone with a public termination for obstructing a Navy SEAL's medical care. Rachel simply nodded. No satisfaction crossed her face. Just acknowledgement. Just the understanding that karma moves in its own timeline, that consequences arrive when they're supposed to, that some people lose everything the moment they choose to dismiss someone they didn't take time to understand. She accepted the position of trauma unit director, Hargrove's old job, offered by the hospital board with something approaching desperate apology. The 7 doctors who'd walked away from her in the break room now worked under her supervision. Chen, Patel, Morrison, Burke, Santiago, Williams, Kozlov. They were professional. Competent. They never met her eyes for long. On her office wall, a photograph of the Tikrit checkpoint, her unit, the faces of soldiers she'd never forget. The Iraqi refugee patient brought his family to meet her one afternoon, his brother with him, the soldier she'd saved 6 years earlier, now married with 2 children who owed their existence to 9 hours of battlefield medicine under mortar fire. Rachel stood in the hospital lobby as the evening shift arrived, just another nurse in scrubs to those who didn't know her, a legend to those who did. She limped slightly toward the trauma bay, ready for whatever came through those doors next. Heroes walk among us. Sometimes in scrubs saving lives in the dark. If this story resonated with you, hit that subscribe button. Comment below, have you ever been judged by someone who didn't know your true value? And share this video with someone who deserves to be seen. Thank you for watching.